Pharmacokinetics, also described as what the body does to a drug, refers to the movement of drug into, through, and out of the body. When applied clinically, pharmacokinetics leads to safe and effective therapeutic management of drugs in an individual patient. Pharmacokinetics takes these factors into consideration: the time course of its absorption, bioavailability, distribution, metabolism, and excretion. Drug absorption is the movement of the drug into the bloodstream after administration. It's determined by the drug's physiochemical properties, formulation, and route of administration. Passive diffusion and active transport are examples of ways drugs can be absorbed. Bioavailability refers to the extent and rate at which the active drug enters systemic circulation, thereby accessing the site of action. Distribution of the drug refers to it being spread to the tissue after entering the bloodstream. The rate of entry of a drug into a tissue depends on the rate of blood flow to the tissue mass, and partition characteristics between blood and tissue. Drug metabolism is the practice of making a drug easier to excrete. Individual drug metabolism rates are influenced by genetic factors, coexisting disorders, and drug interactions. Finally, drug excretion is the process of eliminating the drug from the body. Drug pharmacokinetics determines the onset, duration, and intensity of a drug's effect. Pharmacokinetics of a drug depends on patient-related factors as well as on the drug's chemical properties. Some patient-related factors, such as genetic makeup, sex, and age, can be used to predict pharmacokinetic parameters in populations. For example, half-life of some drugs, especially those that require both metabolism and excretion, may be remarkably long in the elderly. Other factors are related to individual physiology. The effects of some individual factors can be reasonably predicted, but others have unpredictable effects. Because of individual differences, drug administration must be based on each patient's needs. Knowledge of pharmacokinetic principles help those prescribing the drug adjust dosage more accurately and rapidly.